Welcome to the June 2024 MIDAS webinar. My name is Harry Hockheiser, Director of the Center. A while back, at least, we got a request that we have some sort of a meeting or discussion about career paths in infectious disease modeling. And this is one of the things that this MIDAS Coordination Center has really been tasked to do and to focus on, is to help develop people's careers and their aspirations in working in this field. And one of the things about this field that I think is so interesting is that there are a lot of ways that people can go that are sort of beyond what people tend to think of in my field of informatics, which is sort of industry or not. And we see here that people go in a lot of different directions, and even within some of these directions, there's a world of different possibilities here. So we've got a few folks who are all what I'll call early career, I think is the best way to put it. Folks who have been in the not too distant future through this process of taking the leap out of academic programs into their current positions. And we're going to hear from them about some of their questions about how they got where they were, and then what do they do, and the advice they have and comments. And we're going to have each of these folks sort of give their own little story, and then we'll have some time for discussion and dialogue. I want to encourage people to interrupt as need be, raise your hand, put something in the chat or the Q&A, and I will try to referee and bring those in real time. And then hopefully after that, we can have some discussion between folks at the end to see where things are going to go. So let me do a quick introduction to all of our panelists. So I want to thank for taking the time. I'm going to summarize these long bios because I don't think people like listening to long bios read out loud, but just very quickly, Emmanuel Dankwa is a postdoctoral fellow at the Harvard T.H. Chan School of Public Health, where Emmanuel works on the development of mathematical models for the impact of interventions against the spread of multi-drug resistant tuberculosis. And Emmanuel is also active in development of public health analytics in Africa, worked on the University of Global Health Equity Rwanda / Harvard training course in mathematical of infectious disease transmission. Emmanuel has a DPhil in statistical science from Oxford, where she was a Rhodes Scholar, and also first-class honors bachelor's degree in math and stats from the University of Ghana. Guido Espana leads the Community Mitigation and Economics Impact Team at the Center for Forecasting and Outbreak Analytics at the CDC, which is a pretty big deal. Guido was also previously a research assistant professor at Notre Dame and the National University of Columbia. His work focuses on supporting public health decision-making with the use of mathematical and computational models for infectious diseases. He's worked on dengue, chikungunya, Zika, COVID, and a bunch of other things. His background's in electrical engineering. I think I'll leave it at that. Pedro Nascimento de Lima is an associate engineer at RAND. Some folks might have heard talks he's given to the MIDAS Network in the past, but he works a lot on using computational models to inform policy choices, and particularly when uncertainty and consensus seems out of reach. And this is, of course, a big deal because, as we all know, our models are full of uncertainty. And finally, Dasha Pokutnaya is received her MPH in Epi of microbial diseases from Yale and her PhD in epidemiology from the University of Pittsburgh, where I will have to say it was my pleasure to act as a co-advisor in her dissertation work. And I'm not going to say too much more about that, but Dasha was a pleasure to work with. Recently, Dasha has been working as a data science in the NIAID, that's the National Institute of Allergy and Infectious Diseases, Office of Data Science and Emerging Technology, where she's working on data and the development of an AI-ready knowledge base for pandemic preparedness. And she also evaluates data resources across the NIH institutes and conducts portfolio analysis of data science grants. So there's a really great group of folks with, as you can see, I think some different work and experiences. And so I'm going to stop now, and I'm going to hand it over to start with Emmanuel, who's going to tell her story. And Emmanuel, take it away, please.
Hi, thank you very much for the introduction. And so in the next few minutes, I'm going to talk briefly about my career trajectory, some of the things that I learned, how I got to where I am currently, and sort of my hopes for just future career paths. I would like to begin with, I'll be using 4 questions. So mainly starting with, how did I get where I am? Like, what has my career trajectory been? And so as mentioned in the bio, I started my bachelor's degree in mathematics and statistics. And very soon, I realized that I was more interested in the applied side of mathematics than in the abstract part, and thinking about what things I could apply mathematics to. Infectious diseases was one of the things that came up. And after doing a dissertation in malaria modeling, I received my bachelor's degree in Ghana, and so malaria is very relevant there. I found I wanted to continue to do this. And I will say that that was the point where I started learning really important lessons in career decisions and career trajectory. The first lesson I learned was explore as much as you can, because I wasn't sure whether I really wanted to do infectious disease modeling for the long term. But the dissertation was what I would call just a short-term opportunity to explore. And so this wouldn't cost too much. This was only like short-term. And as I tell my story, I'll talk about other things that I've explored short-term too, and how those have been helpful. So I did that, and I found that was what I really wanted to continue in. And that led me to do a PhD in infectious modeling as well. It was in statistics, but I majored really in thinking about modeling infectious diseases. Now, after the PhD, well, during the PhD, if you're doing a PhD or you have done that, you know that you don't start thinking about what you want to do when you're done. You start thinking about it before you're done. So right at the very end, I was thinking, well, what are the possible things I could explore? Again, as when I was doing my PhD, I saw that although I was interested in like getting into the code and doing the modeling work proper, I was also interested, I think part of my mind was on, okay, this paper goes to a journal, and then what? In other words, I really started to become curious about implementation and what happens with the modeling outputs or the modeling products. And so I should also add that that period was also coincided with the COVID pandemic. And I had the opportunity, just the pleasure to work with my PI, to observe, I would say, my PI who was actively involved, and Professor Crystal Donnelly, who was actively involved in the government response to COVID-19 in the UK. And so I saw how, even as an academic, she could be involved in public health response through modeling and through advising the government. I wanted to do something like that. I wasn't sure how to get there. One of the ways that I thought I could get there was to take a master's in public policy. Now, you might be like, ooh, that's like very different from modeling, right? Like public policy, you're going to social sciences and all of that. Because I thought that was the path that would give me some experience in policy as well, I actually did apply to do a master's in public policy. I got in, but I did not end up doing it. What I ended up doing, though, was a postdoc that gave me experience to public health workers, and particularly public health leaders in Africa. And so, again, second lesson I learned was my path does not have to be conventional, right? Like for people working in public health implementation, maybe they have a formal degree in public policy. It does not necessarily have to be the case with you, or as I learned with me, my experience in thinking about public health implementation was through proximity with public health leaders in Africa as I began. I am ending that postdoc now, and I'm in the middle of a transition period. Again, you don't wait till the very end to think about what you do. Naturally, we start to think, even before our contracts expire, what do I want to do next? And still thinking about my lab for public health implementation. In addition to my lab for modeling, I wanted to get more experience in the format, that is in public health implementation, because I've been doing modeling for about 6 years. So 1 year bachelor's degree, about 4 years of a PhD, and a year of a postdoc. I thought that if I wanted to get more experience in public health implementation, then my second postdoc, which I have transitioned to, should be in that area. And so I made the decision of not doing any modeling work for the next year. And now I'm going to be focusing on supporting African countries to develop capacity in public health analytics. The reason why I thought that was important for my career at this point is just thinking through even the limitations, the possible limitations of modeling, which is that if one does not have data and the good data infrastructure, one can have a really good model, but again, the outputs might be limited. And supporting countries to develop their public health data infrastructure is one way of developing the kind of modeling landscape in general. And so I thought that was where I wanted to focus my time, at least for the next year. Now, I'm going to the question of how could others get to be in my position. I think as I spoke through the various points of my thought patterns and what made me make some decisions, I may have touched on that, but just to point that out explicitly, I'm assuming that almost all here have some modeling background. And so for my point of view, if you seek, like me, experience in public health implementation and policy, I'll suggest first of all to let your mentors know, and also talk to your colleagues about it, because they could recommend others to you. One of the things that I've learned so far is relationships matter. And if I was sharing a slide, trust me, matter would be in like capital letters. They matter a lot. And one person connects you to another. And I think in my experience, I got to my current role because one of my PIs in my previous role recommended me to one of her colleagues who was working in public health implementation. Another thing I'll recommend is to try out short-term opportunities. I talked about how when I was starting off, even as a bachelor's degree student, I was like, well, as an undergrad, I wasn't really sure what I wanted to do modeling short term, but there was a 3-month opportunity to get into a modeling course, and I took that. As humans, we really love certainty, and we want to be really sure that what we're going to invest our time in will be fruitful. However, I should say that sometimes we need to get in there before we can have an idea of whether we want that opportunity or not. So I would really encourage to try out short-term opportunities so that you can have a feel of what it might look like without necessarily committing to it long-term. And lastly, I would like to conclude with what I wish I had known earlier. First, again, that relationships really matter, and thinking about not only being like good technically, but also thinking about the social aspects where you are now. I was talking to a colleague yesterday just about working from home and how that is taking away from us a really great aspect of like social connection. And at this point, particularly as an early career professional, I would say relationships are a huge social capital to me. And what I've learned is even with working remotely, making efforts to maybe have coffee meetups or meet with colleagues once in a while I'm in the office. So that has been helpful because it has been through those conversations that I have made, for example, like strides in projects or really thought about other career trajectories I could explore. And the last thing I have learned that I think I would share is the huge disadvantage of comparing my path to others, which is that my path might not be, again, as conventional, might not look like others. In my exploration of public health implementation, so far, I have not needed to explore or pursue a formal course in like public health or public policy, right? I'm coming from like a technical modeling background. Some others might need to do so. And so like thinking, although this might be the career trajectory of the majority, does that apply to me? Do I have the skills, for example, or the time or even money to pursue a formal course? And if you don't, I would advise thinking about alternative routes and not just limiting oneself to what the conventional path has been. So I'd like to end here and hand it over to Harry.
Thanks, Emmanuel. Lots of great comments there. You give me a couple questions I want to ask later, but I'm going to hold off on that. Remind people if they do have questions as we go along to please throw something in the chat of the Q&A. But let's move on to Guido.
Great. Hi, everyone. My name is Guido España. I'm going to talk a little bit about myself and the position that I'm in. I grew up in Colombia, and my focus, my training is in engineering. I started studying electronics engineering for my undergrad, and one of the fields that I really liked in electronics was, well, digital electronics coding, but also I really enjoyed the dynamical system modeling and control theory and all of this. So when I started my master's at the same university, the National University of Colombia, in industrial automation, I focus actually on biological systems. So quickly I was involved into the modeling of infectious diseases, worked on dengue since then. And from the beginning, what was appealing to me was the ability to connect these theoretical concepts that I also share in other backgrounds, like in mathematics, physics, or engineering, with public health impact. So I work with the Ministry of Health in Colombia for this. And then when I started my PhD, I wanted to, which was also in electrical engineering, but with focus on, again, in infectious disease modeling, I wanted to do something else. So I got in touch with the Public Health Dynamics Laboratory at the University of Pittsburgh and spent a predoctoral fellowship there for almost 3 years. And it was a great way to learn about other more complicated and computationally demanding and big agent-based models. At the University of Pittsburgh, worked on Fred, and that's the model, and in chikungunya. And then after I graduated from my PhD, I moved to South Bend to do a postdoctoral fellowship at the University of Notre Dame. Worked a lot on dengue, also on vaccine evaluation, and a lot of this was focused on building agent-based models. We had a very detailed data set for these models in the city of Iquitos in Peru. And it was a great time there, And I spent a couple more years after the postdoc in as a research assistant professor, working in similar questions, but also on COVID-19. My interest has been since basically since I started in the field and having some sort of real world impact. So I like to be connected with decision makers, and I feel like I've been lucky enough to actually have that experience. And during COVID, I was able to also contribute a little bit to the decision making in the city of Bogota in Colombia, where I'm from. Um, and then after that, I just moved now to the CDC, and that's where I'm right now. I'm the team lead of the Community Mitigation and Economic Impacts team at the newest center of the CDC, which is the Center for Forecasting and Outbreak Analytics, CFA. And the mission of CFA is to harness this cutting edge analytics to improve response to public health emergencies. And I'm just gonna talk very briefly about the type of teams that we had at CFA. We have 3 different divisions: Inform, Innovate, and Predict. I am in the Predict division, and the goal for us is to provide forecasting to improve surveillance capacity for outbreaks, epidemics, and pandemics, and to respond to analytical requests within the agency and the federal government. So there are 2 different branches within Predict, is the real-time monitoring and the analytics branch. I am in the analytics branch. We have 3 different teams. We have a team for key populations and settings, medical contaminations and variants, and my team, which is focused on community mitigation and economic impact. So a lot of what we do is to be ready and develop tools to be ready to answer questions, for instance, in my team, about what the impact of non-pharmaceutical interventions would be in different communities. I have been in this position for about a year, and we have already been part of a response, and it's been a great way to contribute what I've already been using for like 12 years in the sense of these mathematical tools, but also trying to make them at a very cutting edge level and enterprise grade level as well. So that's what I do in my current position. How could others get to be in this position? I think my position has 2 different components on it. One that is about actually building models, and I think for this is important to learn about what everyone is doing, probably learning about infectious disease modeling, but also a little bit of a step ahead of that is to actually contribute with others and collaborate and using tools that are actually have been tested, that are not that has code that is readily available, and just working a little bit more also on that side of the technical side of the tools. A lot of my career has been a little bit serendipitous, since I was in a totally different field, but then I found out that a lot of people in my field come from different fields, which is great. So I think early on, and it continues to happen, that it is. I wish, I mean, I've known this for a while now, but I wish people reminded me all the time that it's okay to ask things. I think I started in in Pittsburgh because I just asked about it and say, hey, are you interested in doing anything with me? And they were happy to have me there for 3 years. Similarly, when I started at the CDC, I was very hesitant of applying because I'm not a US citizen. And someone just told me, just send an email and ask. And I was like, okay. So I sent an email and asked, and it turns out that there are other ways to hire people who are not just US citizens. So I think a lot of times there is this barrier of thinking that, you have to, you kind of just shoot an email to people and just ask a few questions. And I think I wish I knew that a little bit earlier. I think I heard from Emmanuel the power of relationships, and I agree with this. But it's relationships that are, for me, a lot like connected in the same field. I think you don't, on a day-to-day basis, you don't know a lot of people who are in the field. So it's great when you go to epidemics or ASTMH or this type of conferences when you actually can talk to people who do basically the same thing that you do, and that can tell you about collaborations, opportunities, and things like that. So I'm gonna leave it there, but I'm happy to answer any questions about anything.
Great, thank you. Let's move on here and hear from Pedro.
Okay. Yeah, it was great to have Guido preceding my few 10 minutes because I have a similar background. So just draw the analogy. So I also am not a US citizen. I'm from Brazil, so South America. That's close enough. And I also have a background in engineering. So, a lot of us have some kind of quantitative training, and then we got interested in modeling. In my case, I had training in industrial engineering, and I was doing some consulting and teaching. I had a master's at that point, and I got very interested in this method created at RAND called robust decision making, and they use those methods to answer kind of big picture questions like what strategies to abate climate change can be robust over the next 100 years. Like technology subsidies or cap and trade systems, things like that, in very different kinds of fields. And I was very amazed to learn that you could use modeling to answer some of those questions that impact like millions of lives. So that was motivated me to apply to a PhD program in policy. And so I applied to Party RAND graduate school in Santa Monica. It's an interdisciplinary program. And then 6 months into my, first year, the pandemic hit. And at that time, I was already working with an infectious disease modeler, Rafael Verdavas, on a flu model and vaccination behaviors. And then at that point, I got pulled into a project to model COVID-19 interventions. And like many of you, I spend way too much time of my life modeling the effect of interventions. And during the COVID-19 pandemic, one thing that we did at RAND, and I think that kind of gives you this idea of what RAND is. So RAND is a think tank. It has the main campus in Santa Monica, but it also has offices in Washington, D.C. and other places. And what that think tank is just an organization that has a policy goal. RAND is a nonprofit, and RAND, there are many kinds of think tanks, right, these days. RAND is a nonpartisan think tank, meaning we do research with objectivity, and we try to present the facts as they are and inform decisions without trying to bias or trying to favor one party over the other. And so RAND has this program and in policy analysis, and that was the program that I applied to. Okay, so during the pandemic, I worked on COVID-19 models, like many of you. We built a model integrating economic models, and we put together a team with economists and infectious disease modelers to put that together in 6 weeks. And I was part of that. And then later I maintained that tool. And then I did a lot of follow-on work based on that model and extensions of that. And so after that point, I was approaching the end of my PhD, and it made a lot of sense for me to just stay at RAND, which is not the path that most people take. to go to Rand, but that was what made sense for me and even some of my colleagues today. So yeah, so that's how I got to Rand. And now I'm an associate engineer. So Rand has these different research career tracks. There's the research leadership track, which is the track you should apply to if you have a PhD and want to be an independent researcher. And so that's what that's the track I'm on. And so it's similar to an academic path where you would go into a tenure track position, except that we don't have tenure track at Rand. We just have the leadership, research leadership track. And I'm also affiliated with the Purdue Rand School, so I'm also faculty, and so I can work with students, I can do research, I can advise students if that makes sense. And yeah, so now I will start getting into what do I do in my current position. So as an associate researcher, I do research. I work with grants, like many people in academia. They work on grants, so that's what I do as well. Although that's not necessarily what you would do at Rand. So Rand has a very diverse set of funders. We have people like myself that works primarily on grants, but we also have people who work primarily on contracts and people who work with contracts for government and some of the health agencies, as well as people who work with the Air Force, the military, and all the government branches. So I will not make this a talk about Rand, but necessarily, but I would say that is very diverse. And so if you do apply to Rand, you kind of shape your own way. It's not a path that is given to you, but it's like a menu of options, and you kind of choose what makes sense for your skills and your interests. What else? I covered what I do in my current position, how others could be in my position. So to get at Rand, you get through the main path, which is just to apply. There is a website, called Jobs, Rand Jobs. So if you just Google Rand Jobs, you will find a description of what I'm talking about here. And you will see that there are several kinds of positions and several departments. So I'll just explain that a little bit because that might clarify how Rand works. So we're a matrix organization. So you have disciplinary departments, and I'm under the engineering and applied sciences department. There's also the economics department, others, and so on. So there's that. And you have the divisions. And so the departments are more related to the disciplines. The divisions are more related to the clients. So we have a healthcare division, we have a national security division, and so on and so forth. And as someone from engineering and applied sciences, I can work across all these divisions. So when you apply to a job at Rand, you apply under a department. And then once you are here, you can work on any division, depending on the project needs. The other thing that is interesting to understand about Rand is that Rand is really, you can think of Rand as a network, and I know you think about that in other contexts, but it is really a network of researchers with a labor market. And so when you get in, you have some time to kind of acculturate and getting into knowing people and finding the projects you want to work on. You can bring your own projects, so you have a lot of independence in that way. But you have this labor market at Rand, and you start connecting with people and possibly writing proposals with them, working on their projects. So you don't necessarily have the obligation to start and already be an independent researcher in that sense of you find your own grants and that's it. But you can kind of join this network of people working in topics that you're interested in. And over time, you build your portfolio and become more independent. So that's how it works. What else? So to join Rand and learn a little bit more about this path, you should look at the website and look at the job positions that you see there. It's also interesting now there's a California transparency law, so you can actually see the pay ranges. So there's a lot more transparency thanks to California law, which is great. What do I wish I had known earlier. So working in a think tank is a little bit different than working in other institutions. And I mean, I'm here because I like how we operate, and I also knew how we worked being in the graduate school, because once you join the graduate school, you already joined RAND, so you already, you remove a lot of the uncertainty just by doing the PhD here. But I think a few things that you should be aware of is that this labor market, it can be a little bit challenging depending on your personality. It takes a little bit more initiative on your part, but it's also a little bit more forgiving in the sense that there's not a clock, a tenure clock possibly, that if you don't meet a set of criteria, you kind of are kicked out of the system. It's not the culture here, and so it can be more challenging, but there's also more flexibility. The other thing with working in an environment like this is that it can be a little bit challenging to balance demand and supply of your time, right? So you might have situations where you have a lot to do, situations you have very little to do, and you kind of have to balance that over time. It's not necessarily easy. And it's also not something I wish I kind of learned a little bit faster, is to be more comfortable with uncertainty about what you would do, because not having zero uncertainty can feel nice, like you know what will happen, but it can be extremely boring. So like dealing with that, it's something that I'm kind of learning how to do. Yeah, so that was my experience at RAND. I'm happy to answer questions about RAND and like think tanks in general. I think my explanation here was very focused on RAND, but there's kind of a broader point about working in think tanks in general. So with that, I will pass on to Harry and Dasha.
Thanks, Pedro. Really interesting. I must say, we've got a common thread of Pittsburgh connections here, because one of RAND's biggest offices is right down the street from the University of Pittsburgh. And so we're familiar with RAND around here. Dasha, want to close us out, please?
Sure. And I have some slides to help guide my discussion here. You see my screen?
Yes.
All
Yes.
good. Thank you.
All right, great. Hi, everyone. My name is Dasha Pakutnaya, and I'll be talking about my first year at the NIAD Office of Data Science and Emerging Technologies, or ODSET, as I'll call it from now on. And I'll give a little bit about how I got to where I am today. So I'm going to start with my academic trajectory all the way back when I received my bachelor's in arts and biology at the University of Minnesota Morris. This is a very small liberal arts school in the middle of nowhere, Minnesota. And it's where I found a passion for biology and statistics. And I went to one of my favorite statistics professors and I asked him, how can I combine these two interests together? And he gave me three options. He said I could either work with tree ring data, I could work with pig data, or I could work with truck drivers and sleep apnea. So for the next 3 years, I worked with truck drivers and sleep apnea data and crash risk, really doing epidemiological work before even knowing the word epidemiology. Later then in my senior year, I took a class in entomology, and there was a class about vector-borne diseases that I really liked. And so I thought, how can I combine vector-borne disease, statistics, and biology together? And I found that I could enroll in a master's program that focuses just on that. So I enrolled in the Master's of Public Health and Epidemiology of Microbial Diseases from the Yale School of Public Health. And there I worked mostly on tick-borne diseases. So I worked in a tick testing lab, and I did wet lab work, and I did data analysis, and I found that I liked the data analysis more than the wet lab. And I also realized that I had to continue building my analytical skills. So I decided I was gonna continue in academia, and I enrolled at the University of Pittsburgh School of Public Health to receive my PhD in epidemiology. And it was at this time I was also a MIDAS graduate student researcher under the guidance of first Dr. Wilbert Van Panhouse, who many of you may know. He was the director of MIDAS prior to Dr. Harry Hockheiser. And I, at this point, did a really large pivot in the research that I was focusing on. I went from thinking about vector-borne disease and modeling, and more so thinking about reproducibility and how to improve the accessibility of the data and the metadata in infectious disease computational modeling studies. But I still really wanted to get experience working with infectious disease data. So I did a summer internship at Sanofi Pasteur, that's the pharmaceutical company. And approximately at that time, Dr. Wilbert Van Panhouse ended up leaving MIDAS and Pittsburgh to become the director of NIAID ODSET, which will be important later on in this story. But it allowed me to also dip my toes into sleep and maternal health with my new advisor. So at this point, I had my defense date set, and I, was hopeful I was going to graduate, but I had to start thinking about what I was going to do after being in academia for 10 years. And I was really torn between several different things. I was thinking about postdocs. I was thinking about industry work. I really liked working at Sanofi. Maybe I'd want to do something like that. And I had heard about some government work as well, particularly like the EIS officer position at the CDC. And to start thinking about what I wanted to do, I thought, I should probably reach out to my network. This has been, an important conversation topic that other panelists had talked about. And I connected with people from, I guess, my past. I talked to people at Sanofi, I talked to postdocs, I talked to professors, and I asked them to recommend other people that they could that I could also talk to. And I set up these informational interviews really to get an understanding of how these individuals got to where they are today, and if they had any, guidance for me as I was thinking about what I wanted to do. And I also looked, of course, on Indeed just in case to, apply for jobs and have something so that I didn't have anything, so make sure that I had something once I graduated. And it was during these informational interviews that I reached back out to Dr. Wilbert Van Panhouse, and I asked him just to get coffee. And I wanted to learn more about NIAID ODSET and federal government work. And he said, there's actually a position open in our office that you can apply for. You could, with this position, you can continue using the skills that you learned during your dissertation work. You can continue learning new skills on the job, and it could get you kind of a foot in the door of government work. And if you end up not liking it, it's still never, a bad idea to have that you worked at NIAID on your resume. So I said, that sounds like a great idea. I really enjoyed working with you. I love to continue working with you. So I started as a NIAID Emerging Leaders in Data Science Fellow of August 2023. And then shortly after, I transitioned from a fellow to a contractor for Axel Informatics. It's a contracting company. And my duties remained the same. Essentially, I just received more benefits after transitioning from a fellow to a contractor. I also want to do a really quick plug. Right now, we have 1 to 2 positions open for a NIAID Emerging Leaders in Data Science Fellow in our office. So if you're interested at all, reach out to me. And I also have additional information on the last slide. So many of you have probably heard about NIAID. Our mission at NIAID is to expand the breadth and depth of knowledge in all areas of infectious, immunologic, and allergic diseases. And we have another mission as well to rapidly respond to new and emerging threats. And on the left is just a very, very high level view of our divisions. Our office is actually within the Office of Management and Operations, but we work with other divisions seen at the bottom here, such as the Division of Intramural Research, the Division of AIDS, Vaccine Research Center, and so forth. And I'll go back actually real quick. So we're in the Office of Management and Operations, and if you take another step and look more closely into the Office of Science Management Operations, here are all the offices under that office. And here we are down here at the bottom. So this chart really just gives you an idea of the complex organizational structure of NIAID and how many offices there are that work together to fulfill the NIAID mission. Specifically for ODSET, our mission is to maximize the efficient use of data and computational methods to improve the understanding of infectious and immune-mediated diseases. And we also help coordinate and execute NIAID's data science strategy across research and training initiatives. And as I mentioned, we work across all NIAID divisions. We really help, empower and enable divisions and staff members to efficiently use data and computational methods. We promote awareness of data science activities. We advise across NIAID staff on data sharing methods and approaches, and we help connect scientists to one another. Our office itself is quite small and also fairly new. We have individuals who work on data science research and training initiatives. We also have individuals who work on data sharing policy and guidelines. But because we're so small, everybody in our office has the ability to help, each other, and you kind of get to work on a variety of different activities during our time there. So not one person is not just focused on one thing the entire time. So because of that, I am involved in a lot of different activities. For example, I'm the executive secretary of the Data Science Working Group. So I'm helping develop the strategic plan for data science at NIAID. I'm also part of the development of an AI knowledge base for pandemic preparedness. So here I get to use more of my coding skills in R, and I'm looking at structural biology data of different flaviviruses. I'm also part of a NIAID data science portfolio analysis team. So we're defining things like artificial intelligence, machine learning, and finding out how much funding is being allocated to those different categories at NIAID. I also still get to write manuscripts. So I'm writing one right now in collaboration with someone else on my team. And then we also collaborate with groups from outside of NIAID. So we're collaborating with a team called Go Fair US to improve the findability, accessibility, interoperability, and reusability, or the fairness of NIAID data supported resources or repositories. And then as far as things that I wish that I knew earlier, I wish I knew more about the different types of paid fellowships that are out there. I had heard a lot about the EIS officers at the CDC, but there are a lot of other fellowships out there that would help you get in the door, I guess, to other government positions. So here is just a table of some of those fellowship programs. They all have different eligibility criteria, durations, and pay. But if you're at all interested in government work, I would consider checking some of these out. And with that, I want to say thank you for allowing me to speak here today. And if you have any questions, I still use my pit.edu email, so reach out, or you can connect with me on LinkedIn. I also have some links to our NIAID ODSET office website, the data science website, as well as the NIAID Emerging Leaders in Data Science opportunity that I had mentioned earlier. And I'll stop sharing.
Thanks, everybody. I'm going to open things up for questions here. We've heard a lot of good thoughts, and I've got a couple of things I'd like to probe at. But first, I want to see if there's anything from the audience here. So please unmute yourself or raise your hand, or just put something in the Q&A. And if I don't see anything in a second, I'm going to fire off with my question. So I think I heard two strong themes sort of coming up that I just want to emphasize here, because they really resonate with my experience as somebody who's both been in research and been the person hiring people who are early in their career. But really, sort of the one theme was working your networks and talking with the people that you know and learning from them. I think I heard that in different ways from almost all the panelists, and I think I can't stress that enough, that you don't want to turn every interaction you have with somebody professionally into an instrumental question of what can you get out of them, but meet people, make friends, learn names, and call on those folks, and and ask them for the advice, ask them for the opportunities, and that's always a winning strategy. I can't recommend that highly enough. The other comment I'll make here, which I'd also like to speak on is what resonates very much for me, given my career. And this is not about me, so I'm not going to go into details, but I'll just say that if you try to find a career trajectory in my path and my work, if anybody were to take a look, I'd love to hear somebody come up with a trajectory, because I can never figure out what it was or is. And I've gone a lot of places that I never would have expected to get. And so I think Emmanuel said this very nicely, that this sort of, be unconventional. And I want to hear the panel's thoughts on tensions, or whether they've struggled at all with the question of generalization versus specialization, and how they suggest dealing with that. But fire away. Any thoughts to that? Should people generalize? Should they be specialists? Well, what do you suggest?
I don't know. I think a combination of both. I think in my experience, it's very good to be a generalist, but it's also very good to be also an expert on something. So it's I used to be told in college that I some things I need to learn just enough to talk to others about it. And I think I'm not an economist, but I've had to do a lot of economic studies, and it's good to learn the bare minimum to be able to talk and to learn more and all that. But it's also good for me, at least in my experience, to have this unique set of skills. So a little bit of the generalist view, but also be an expert on something and kind of like fill that gap a little bit too. So I don't know, maybe not over specialized, but some specialization maybe for me.
Yeah, it makes sense. And what I would maybe add to that is that, like, you can think about specialization as kind of putting a constraint in what you will learn. And so you kind of put a constraint there and just you go, vertical. And so like, yeah, so if you're going to do specialization, like just make sure that your constraint is not overly it's overly constrained, that will prevent you from going to an opportunity that you would otherwise like. Like, just don't over specialize to a point where it really prevents you from taking an opportunity that you would really like. It's hard, it's easier said than done, but I feel like that's kind of the heuristic that I kind of try to follow.
Yeah, and if I might just sort of add an interpretation to that, I think one way to look at it is to say that specializing so that you have some deep expertise in the topic of your area is great, but then generalizing, as in being willing to go into areas that are not that particular area and keeping your eyes and your mind open to new possibilities. I think that's the way to be a good generalist. I often say that a lot of things that I've really found the most challenging are things that came up because somebody said, "Hey, would you consider doing X?" And I looked at that and said, "Yeah, sure, I'll give it a try," even though X was not something I knew much about. And so that's another way to go about it. I'm also curious if any of the panelists had any thoughts, or they heard anything from each other that they wanted to pull on. Not to put you on the spot, but not getting any questions here, so I'll come up with something else in a second. I guess then another thing here that I think was a trend was this question of where one falls in this field on the sort of research versus I don't want to be careful about how I say this, but it's research versus implementation, or the public policy side here. We could have easily had on this call a bunch of folks with comparable degrees who were actively working in health departments, for example, doing real work as real public health professionals. And I think everybody I talk to in infectious disease modeling is interested in having some sort of an impact. And I think the question of how to pick your path so you have the impact that you want to have is another one that people might be thinking about. So curious if anybody's got any comments on that.
I can take a stab at that, but I think, at least for me, research and implementation has always been hand by hand, because a lot of my research, even since I started doing this in my master's, has been connected to a specific public health decision question. And it's spending enough time doing research helps with also kind of like shaping the field where you want to have an impact. So for me, just like having enough exposure, but from the sidelines, so having exposure to the CDC, for instance, from academia or from the National Institute of Health in Colombia, it was good for me to figure out where my contribution could be, and that my contribution is not that I have to go and study public health to make an impact, but that just from even with my engineering background, I can contribute and complement like each other's expertise. And so having those experience, and also, well, the good thing about the academia and the researchers that did not have to commit to actually going that path at once. It looked like that was the best way that I was going. And once CFA was, for instance, created, then it looked like an obvious place to go.
I also wanted to add that in my own deliberations of deciding where I want to go, given that I have a very strong research background, but also a lack for implementation, one useful chat with somebody who is higher up in research just pushed me to really define for myself what implementation is. This is what I mean. There are so many steps involved, from the translation of research outputs to an actual, say, hospital built in a city, right? And thinking about the fact that one cannot be involved in all of these steps practically. And so to think, where can I position myself in a way that balances both my skills? Where can I position myself on that skill, well, on that spectrum of activities, in a way that balances both my skills and also my interest? And thinking about how that, if we want to imagine, say, filling up a bucket of water and everybody is like dropping, is putting in drops. I wouldn't put like a whole gallon. I would just have to put in a drop. In other words, I'm saying that idea of implementation might not look like one defines it in terms of, oh, I really want to be the one, say, cutting the sword for a project, say. But it could be that I am the one helping to generate the data that feeds into, say, priority setting processes. And so just summarizing what I understand by this is, if I want to think about balancing or holding in tandem, like a desire for research and a desire for implementation, is asking myself, is first reviewing the several possible steps on that scale and saying, at which step do I want to be positioned? I could be an academic having a relationship with a local public health authority, or I could actually be working in a state department helping to administer a project. And it's really about where, again, my research skills balance my interest.
Yeah, and one other comment I want to make here that I think is worth keeping in mind is that there is a model, there may be some perceptions in people's heads that once you leave academia, it's hard to get back. And my impression has been that that's not really the case in the way that it might have been in prior years. That I know many people who've spent time out of academia or away from academia and have found their way back in. And so these things can be fairly fluid. And I don't think I think there are very few decisions that lock people into specific tracks or close certain doors. Certainly, any decision requires that you're moving somewhere, but the idea that any of these decisions is irrevocable, I would advise people not to worry too much about that. Well, we're a couple minutes past the hour, so I think it's probably about time to wrap up here, and I'm not seeing any other questions, but thanks to the panel. I know I found this interesting to hear and great to hear the different stories. I hope the people who attended did as well. I want to encourage people, to reach out to these panelists and others, and I'm guessing most of them would be happy to get an inquiry and happy to take questions. If anybody said, hey, what about X, Y, or Z? We will get this posted soon on the MIDAS YouTube page. And once again, thanks to the panelists. Thank you all for attending, and take care.